Have you or a loved one started experiencing bewildering changes in thoughts, feelings, or behaviors later in life? Perhaps seeing or hearing things that others don't, or feeling a growing sense of suspicion and fear. It can be a confusing and isolating experience, but you are not alone. What is schizophrenia? Schizophrenia is often thought of as a condition that begins in young adulthood, but it can also emerge later in life. This is known as late-onset schizophrenia. This video is for seniors experiencing these symptoms for the first time and for the families and caregivers who support them. What is late-life schizophrenia? Late-life schizophrenia is typically defined as schizophrenia that first appears after the age of 40. It is characterized by symptoms of psychosis, such as hallucinations and delusions, as well as disorganized thinking and behavior. While the core symptoms are similar to early-onset schizophrenia, there are some key differences. Individuals with late-onset schizophrenia are more likely to experience persecutory delusions and hallucinations. They also tend to have fewer negative symptoms, such as emotional flatness and lack of motivation, and less severe cognitive impairment. The science behind late-life schizophrenia. The exact causes of late-life schizophrenia are still being researched, but it's believed to be a combination of genetic and environmental factors. In the brain, schizophrenia is associated with an imbalance of neurotransmitters, particularly dopamine. This can disrupt communication between different brain regions, leading to the symptoms of psychosis. While the dopamine hypothesis is a cornerstone of our understanding, recent research points to a more complex picture, especially in late-life onset. Neuroimaging studies suggest that brain changes related to aging might play a significant role. For instance, a natural, age-related reduction in brain volume, particularly in the frontal and temporal lobes, areas crucial for thinking and perception, may lower the threshold for psychotic symptoms to appear in vulnerable individuals. Furthermore, factors like cerebrovascular disease, issues with blood flow to the brain, chronic inflammation, and changes in other neurotransmitter systems like glutamate and acetylcholine are being investigated as potential contributors. It's also hypothesized that some older adults may have had a lifelong subclinical vulnerability to psychosis that only becomes apparent when the resilience of the brain is challenged by the aging process, a major illness, or significant psychosocial stress like bereavement or social isolation. This is why a thorough medical workup is so critical in late-life cases to rule out other medical or neurological conditions that can mimic psychosis. Here are some key statistics to understand the prevalence of this condition. Approximately 20% of individuals with schizophrenia are diagnosed after the age of 40. Women are more likely to develop late-onset schizophrenia than men. Common myths and misconceptions. There are many myths surrounding schizophrenia that can lead to stigma and misunderstanding. Let's address a few of them. Myth: people with schizophrenia are violent. Fact: the vast majority of people with schizophrenia are not violent. They are actually more likely to be victims of violence than perpetrators. Myth: schizophrenia means having a split personality. Fact: this is a common misconception. Schizophrenia is a thought disorder, not a personality disorder. The term split personality is more accurately associated with dissociative identity disorder, a completely different condition. Myth: schizophrenia is a character flaw or a result of bad parenting. Fact: schizophrenia is a medical illness, just like diabetes or heart disease. It is not caused by personal weakness or poor upbringing. 8 techniques to help manage late-life schizophrenia. Managing late-life schizophrenia requires a comprehensive approach that includes professional treatment, family support, and practical coping strategies. Here are 8 techniques to help manage the condition. 1. Psychoeducation for patients and families. What it is: psychoeducation involves learning as much as you can about schizophrenia, its symptoms, treatments, and coping strategies. This can be done through therapy, support groups, books, and reliable online resources. Why it works: understanding the illness helps to demystify it and reduce fear and stigma. For families, it can foster empathy and improve communication. For patients, it can empower them to take an active role in their own care. How to do it: ask your doctor or therapist for recommended reading materials or websites. Attend family psychoeducation programs, which are structured interventions that provide information and skills training. Join a support group such as those offered by the National Alliance on Mental Illness, NAMI. Benefits: reduced relapse rates, improved medication adherence, and better family relationships. 2. Social skills training, SSRE. What it is: SST is a type of behavioral therapy that helps individuals with schizophrenia improve their communication and interpersonal skills. Why it works: schizophrenia can make it difficult to read social cues and interact with others. SST provides a structured way to learn and practice these skills in a safe environment. How to do it: SST is typically done in a group setting led by a therapist. Sessions may involve role-playing, modeling, and feedback to help participants learn skills such as starting a conversation, making eye contact, and expressing feelings appropriately. Benefits: improved social functioning, better relationships, and increased independence. 3. Cognitive remediation, CR. What it is: CR is a behavioral intervention designed to improve cognitive skills such as attention, memory, and problem solving. Why it works: cognitive deficits are a core feature of schizophrenia and can interfere with daily functioning. CR uses targeted exercises to help strengthen these cognitive abilities. How to do it: as CR can be done through computer-based programs or in-person sessions with a therapist. The exercises are designed to be challenging but achievable and gradually increase in difficulty. Benefits: improved cognitive function, which can lead to better work performance and independent living skills. 4. Establishing a consistent routine. What it is: creating a predictable daily schedule for meals, medication, sleep, and activities. Why it works: a consistent routine can provide a sense of stability and reduce stress, which can be a trigger for psychotic symptoms. How to do it: use a calendar or planner to map out a daily and weekly schedule. Set regular times for waking up, eating meals, taking medication, and going to bed. Include a balance of activities such as exercise, hobbies, and social time. Benefits: reduced anxiety, improved sleep, and better overall functioning. 5. Stress management techniques. What it is: learning and practicing techniques to manage stress, such as mindfulness, deep breathing, and progressive muscle relaxation. Why it works: stress can worsen the symptoms of schizophrenia. These techniques can help to calm the nervous system and reduce the physiological effects of stress. How to do it: mindfulness. Pay attention to the present moment without judgment. You can practice this by focusing on your breath, the sensations in your body, or the sounds around you. Deep breathing. Inhale slowly through your nose for a count of 4, hold your breath for a count of 7, and then exhale slowly through your mouth for a count of 8. Repeat this several times. Progressive muscle relaxation. Tense and then relax different muscle groups in your body, starting with your toes and working your way up to your head. Benefits: reduced anxiety, improved mood, and a greater sense of control over your emotional state. 6. Healthy lifestyle habits. What it is: adopting a healthy diet, getting regular exercise, and avoiding alcohol and drugs. Why it works: physical and mental health are closely linked. A healthy lifestyle can improve overall well-being and reduce the risk of other health problems. How to do it: diet. Eat a balanced diet with plenty of fruits, vegetables, and whole grains. Exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Avoid substances. Alcohol and drugs can interfere with medication and worsen symptoms. Benefits: improved physical and mental health, increased energy levels, and better management of medication side effects. 7. Creating a supportive environment. What it is: fostering a home environment that is calm, predictable, and supportive. Why it works: a supportive environment can help to reduce stress and provide a sense of safety and security. How to do it: for families: practice active listening and empathy. Use clear and simple communication. Avoid criticism and judgment. Establish clear boundaries. For patients: communicate your needs and feelings to your loved ones. Participate in family therapy to improve communication and problem-solving skills. Benefits: stronger family relationships, reduced conflict, and a greater sense of connection and belonging. 8. Developing a crisis and relapse prevention plan. What it is: a proactive written plan that you create with your loved one and their healthcare team when they are stable. This document outlines the specific steps to take if symptoms worsen or a crisis occurs. It's a roadmap for navigating difficult times before they happen. Why it works. During a psychotic episode, insight and judgment can be impaired, making it difficult for the individual to recognize they need help. A crisis plan created during a period of lucidity respects their autonomy and ensures their wishes are considered. For families, it removes the guesswork and panic, providing a clear, agreed-upon protocol to follow. How to do it: identify early warning signs. Together, list the subtle, personal signs that indicate symptoms are returning. This could be changes in sleep patterns, increased social withdrawal, neglecting personal hygiene, or expressing more suspicious thoughts. List coping strategies. Document the strategies that have helped manage these early warning signs in the past, such as reducing stimulation, practicing relaxation techniques, or increasing support from a specific person. Outline action steps. Clearly define who to contact and when. This should include phone numbers for the psychiatrist, therapist, and a local crisis team or psychiatric emergency service. Specify at what point a family member should take charge of making appointments or seeking emergency care. Include practical information. The plan should contain a list of current medications and dosages, any allergies, and the contact information for all members of the healthcare team. Benefits. A crisis plan empowers both the patient and the family. It reduces the severity and duration of relapses by promoting early intervention, minimizes the need for involuntary or emergency treatment, and builds a sense of security and collaborative care. Do's and don'ts for family members. Do's: do, educate yourself about schizophrenia. Do, encourage treatment and medication adherence in a supportive, non-judgmental way. Do, be patient and understanding. Do, listen with empathy and validate their feelings. Do, help them to set realistic goals. Do, celebrate small successes. Do, take care of your own mental and physical health. Don'ts: don't argue with their delusions or hallucinations. Don't criticize or blame them for their illness. Don't tolerate dangerous or inappropriate behavior. Don't expect a quick recovery. Don't give up hope. Navigating daily life, practical skills and environmental adaptations. Managing a chronic condition like late-life schizophrenia extends beyond therapy and medication. It involves adapting daily routines and the living environment to foster independence and well-being. This section focuses on practical, everyday strategies that can make a significant difference. Developing structured routines. Why it's important. A predictable daily schedule can be incredibly grounding. It reduces the cognitive load of having to decide what to do next, which can be overwhelming when dealing with symptoms. A consistent routine provides a sense of stability and security. How to create a routine. Start with the basics. Begin by scheduling essential activities like waking up, meal times, medication times, and bedtime. Incorporate appointments and chores. Add in regular appointments, household chores, and other responsibilities. Schedule enjoyable activities. It's crucial to include time for hobbies and leisure. This could be gardening, listening to music, or going for a walk. Be flexible. A routine is a guide, not a rigid set of rules. It's important to allow for some flexibility. Example routine. 8 a.m. Wake up, take morning medication, and have breakfast. 9 a.m. Gentle stretching or a short walk. 10 a.m. Engage in a hobby or leisure activity. 12 p.m. Lunch. 1 p.m. Quiet time for reading or listening to a podcast. 3 p.m. Afternoon snack and a simple chore. 5 p.m. Prepare and eat dinner. 7 p.m. Evening medication and relaxation time. 9 p.m. Wind down for bed with a calming activity, enhancing communication skills. For the individual with schizophrenia, Use I statements. Instead of saying you don't understand, try I feel misunderstood. This can help to reduce defensiveness in others. Keep it simple. It's okay to use short, simple sentences to express your needs. For family and caregivers, use clear and simple language. Avoid complex sentences and abstract concepts. Be patient. Allow the person time to process what you've said and to formulate their response. Listen actively. Pay attention to what they are saying, both verbally and non-verbally. Reflect back what you've heard to ensure you've understood correctly. Cognitive aids and memory supports. The challenge. Cognitive difficulties, such as problems with memory and attention, are common in schizophrenia. Practical tools. Calendars and whiteboards. Use these to keep track of appointments, to-do lists, and important reminders. Pill organizers. These are essential for managing medication schedules. Smartphone apps. There are many apps available for setting reminders, creating lists, and managing tasks. How to implement. Place these aids in a visible location, such as the kitchen or living room. Creating a calm and safe home environment. Reducing sensory overload. Minimize noise. Use earplugs or noise-canceling headphones if necessary. Reduce clutter. A tidy and organized space can be calming. Use soft lighting. Avoid harsh fluorescent lights. Safety considerations. Remove tripping hazards. Keep floors clear of clutter and secure any loose rugs. Ensure good lighting. A well-lit home can help to prevent falls. Managing finances and daily tasks. Breaking down tasks. Large tasks can be overwhelming. Break them down into smaller, more manageable steps. For example, instead of clean the kitchen, the steps could be wash the dishes, wipe down the counters, and sweep the floor. Seeking support. It's okay to ask for help with more complex tasks, such as managing finances or navigating public transportation. A family member, friend, or case manager can provide assistance. The role of meaningful activities. Combating apathy and anhedonia. Apathy, lack of motivation, and anhedonia, inability to feel pleasure, are common negative symptoms of schizophrenia. Engaging in meaningful activities can help to counteract these symptoms. Examples of activities: creative pursuits, art, music, writing, or crafting. Nature-based activities, gardening, walking in a park, or birdwatching. Gentle exercise, yoga, tai chi, or swimming. Volunteering, helping others can provide a sense of purpose. Information on professional treatment and medication. Therapeutic approaches. Cognitive behavioral therapy for psychosis, CBTP. This type of therapy can help individuals to identify and change unhelpful thought patterns and behaviors. It can also help them to develop coping strategies for managing symptoms like hallucinations and delusions. Family therapy. This can help to improve communication and problem-solving skills within the family. It can also provide a space for family members to learn about schizophrenia and how to best support their loved one. Group therapy. This provides an opportunity for individuals with schizophrenia to connect with others who have similar experiences. Medication. Antipsychotic medications. These are the primary medications used to treat schizophrenia. They work by balancing the levels of neurotransmitters in the brain, which can help to reduce symptoms like hallucinations and delusions. Types of antipsychotics. There are two main types of antipsychotics: typical, first generation, and atypical, second generation. Atypical antipsychotics are generally preferred for older adults because they have a lower risk of certain side effects. Important considerations. It's crucial to work closely with a doctor to find the right medication and dosage. Antipsychotic medications can have side effects, especially in older adults. It's important to report any side effects to your doctor. Never stop taking medication without consulting your doctor first. Precautions and potential dangers. Leaving late-life schizophrenia unaddressed can have serious consequences. It can lead to a decline in physical and mental health, strained relationships, and an increased risk of suicide. It's also associated with a higher risk of developing other medical conditions, such as heart disease and diabetes. Early diagnosis and treatment are essential for improving long-term outcomes. Managing co-occurring health conditions. A critical aspect of managing late-life schizophrenia is paying close attention to physical health. Older adults with schizophrenia have a higher rate of co-occurring medical conditions, which can complicate treatment and impact their quality of life. The importance of integrated care. Integrated care is an approach where mental health and physical health providers work together as a team to manage a person's overall health. This is vital because symptoms of schizophrenia, or side effects from medication, can sometimes mask or be mistaken for symptoms of another illness. For example, apathy and fatigue might be seen as negative symptoms of schizophrenia when they could also be signs of an underactive thyroid or heart disease. Common co-occurring conditions to monitor. Cardiovascular disease. Antipsychotic medications can sometimes affect weight, blood pressure, cholesterol, and blood sugar, all of which are risk factors for heart disease and stroke. Regular monitoring by a primary care physician is essential. Type 2. Diabetes. The link between antipsychotic medication and an increased risk of diabetes is well established. Your doctor should perform regular blood tests to monitor your blood sugar levels. A healthy diet and regular exercise are crucial preventative measures. Osteoporosis. Older adults, particularly women, are at risk for bone density loss. Some medications can increase this risk. Ensuring adequate intake of calcium and vitamin D, along with weight-bearing exercise, can help maintain bone health. Falls and mobility issues. Side effects like sedation, dizziness, or muscle stiffness can increase the risk of falls in older adults. It is important to create a safe home environment, remove tripping hazards, and discuss any concerns about mobility with your doctor. Proactive steps for patients and families. Ensure the individual has a regular primary care physician they see at least annually for a full physical. Keep a shared list of all medications, psychiatric and otherwise, and bring it to every doctor's appointment. Encourage open communication between the psychiatrist and the primary care doctor. Help monitor for physical symptoms, and don't assume everything is related to schizophrenia. Report new physical complaints to a doctor promptly. How to make it a sustainable habit. Start small. Don't try to implement all of these strategies at once. Choose one or two to start with and gradually add more as you feel comfortable. Anchor to existing routines. Attach new habits to things you already do. For example, you could practice deep breathing for a few minutes after you take your morning medication. Track your progress. Keep a journal to track your progress and celebrate your successes. Find social support. Share your goals with a trusted friend or family member who can provide encouragement and accountability. Be kind to yourself. There will be good days and bad days. The important thing is to keep moving forward, one step at a time. Conclusion. Living with late-life schizophrenia can be challenging, but it's important to remember that recovery is possible. With the right combination of professional treatment, family support, and practical coping strategies, individuals can manage their symptoms and live full, meaningful lives. Remember that you are not alone, and there is hope for a brighter future. Disclaimer. This video is for educational and informational purposes only. The information we're sharing is designed to support, not replace, the relationship that exists between you and your healthcare provider. If you found this video helpful, please give it a like and subscribe to Mental Wellness Insight for more doctor-approved wellness tips. Share this video with someone who might need it. Which of these techniques will you try first? Share in the comments below.